We are going to get moving forward here with our second session of this webinar this morning. Um, Tools for Independence, Assistive Technology as we move into adulthood. So please help me welcome Scott Youngs, who is a senior project manager at the Nevada Center for Excellence in Disabilities here. He is the head of the Nevada Assistive Technology Resource Center, which we affectionately call NATRC, and Mike Marbury from CareChest to let us know how they support assistive technology moving into adulthood.
All right, so I'm going to go ahead and share my screen. All right, can everybody see that okay?
Yes.
All right. Good morning, everybody. I was interested in hearing all the stories of people getting out there and getting it done for employment and being self-advocates. So I love to hear those stories. My name is Scott Youngs. I'm the director of the Nevada Assistive Technology Resource Center at the Center for Excellence in Disabilities at UNR. And Mike Marbury from CareChest as well is going to help me with talking about assistive technology, mainly in moving from the school environment K-12 into adulthood and beyond. So I've got a kind of a group of slides that I'm going to show everyone that kind of tells you who we are and what we do, how assistive technology can play a role in transition and improve quality of life for people with disabilities. So I'm going to kind of go into a little bit of a background about where we get our funding and how the structure and organization kind of works, to give you a little bit of background on that. It's always good to do that. So the Nevada Assistive Technology Resource Center, we kind of call it a lending library of assistive technology equipment, but it's really much more than that. There is a federal AT Act, Assistive Technology Act, and so we get our funding from the federal government. That funding comes from them to the state through Aging and Disability Resource Center, or Aging and Disability Services Division, with the state, and they put it out as a subaward, and we apply for that funding. We've had that funding for about 15 years now, and we are part of what they call the state calls the Nevada Assistive Technology Collaborative. So that includes us, the NATRC. It includes CareChest and their Assistive Technology for Independent Living program. Also includes part of their Care Loan program, and the Nevada Disability Advocacy and Law Center also get a little bit of money for assistive technology, and they call it the Protection and Advocacy for Assistive Technology. So they get a very small piece of federal funding to do that. And we'll talk a little bit more about those resources and how they kind of go together in a little bit. So the NATRC offers statewide services. So we have offices both in Reno and Las Vegas, but we serve all of Nevada. And our 5 areas of services are information and assistance. We do device demonstrations and loans. We also do quite a bit of training, technical assistance. And part of that funding is directed to be used towards transition. And I'll go into a little bit more detail about the definition of transition in a little bit. But the last one is we do a lot of public awareness and outreach about who we are and what we do as well. Our philosophy that we embed in the whole program is the independent living philosophy. We work with all sorts of different people with disabilities, all ages, but the philosophy there is to give control back to the consumer so that they have choice, control, and can direct and advocate for the things that they want in their lives. So it's really big to offer choice. If people don't know what their choices are, they can be limited in a way. So we try to provide as many options and resources as possible to families and the people that are asking the questions in order for them to make informed decisions. So if you don't know about all of those things like the Ticket to Work and the PASS program and all of those other things, how they work or how they don't work, you can be left behind in those decisions. So hearing a little bit of that just a minute ago from families that don't may benefit by talking to more people about how they did it and what the rules are and what the hoops are to jump through and all of that. So really it's about getting all the information that you can and making informed decisions. So kind of a couple of the do's or the what we can provide and what we can't provide. So with our federal funding, it's very prescriptive on what we can offer people, right? So it's really about helping people explore options in assistive technology. So we can help with support and provide resources and information. But what we can't do is use those funds to purchase equipment for individuals. So that's where I think a lot of people that call us think we are a funding source, and we are not. We're everything up to that point. So if you have Medicaid or regional services, Maria mentioned the what did you call it? The part of the plan that can pay for things.
Goods and services.
Goods and services. Mm-hmm. That's all resources that you may or may not be qualified for depending on your situation. So we're out there to guide you in that process. We put the individual at the center of that conversation every step of the way. The other thing that we don't do is we don't supplant a professional assessment if that's needed in a process. So a lot of times people think that we can go out and provide an assessment of like a recommendation for an assistive technology device, something that Judy might do as an OT or a PT might do or a speech therapist might do if there's a communication device that's necessary. So those are only things, a couple things that we can't do. All right, so a little more information on the 5 areas of services and supports. Information and assistance is where it all starts, and you might call it information and referral, but we try to use that word assistance because there's too many times in our service delivery program, you get a little information, then you get an immediate referral to somebody else that's going to handle the situation. And part of the language in the act is that, we provide information, but it really is a level of assistance that engages the individual in conversations about the program, what your resources might be. And it might include a referral to other agencies if there's other things going on that we think other agencies can take care of right then. But for the most part, it's really engaging the individual in figuring out what their barriers are, what they need, and what their goals are. And we'll talk a little bit about that in a little bit. But that sometimes puts people off because conversations, you try to find out as much information you can about how people are doing it, what their barriers are, what the challenges are, and what are the dreams and goals down the road. But it's a kind of a nosy conversation into how are you doing things now, and what resources might you have that could help in this journey as well, to really identify what the struggle is, what they're trying to accomplish on a daily basis. So whether it's trying to go to work or live in the community or whatever, it's really once that phone rings, we really try to just help that person on that journey, whatever that might look like. So the meat and potatoes of our program is really the device demonstration and device loan. So we have lots and lots. I don't, at least a few thousand devices and things, gadgets and gizmos that we can demonstrate to people. So once we have that conversation and we kind of learn more about the challenges and the barriers that someone has, we show them a bunch of things, give them options on, okay, based on our conversations, you said that you want to kind of explore this area, and we kind of narrow that down a little bit. So we offer to demonstrate different, if it's a communication device or a learning tool or whatever, we try to show that person as much as we can. Here's 5 or 6 options that might help you with this. And then they kind of help us make decisions on, are we on the right track? Are we not on the same page here? Once we narrow that down, we do have the ability to allow that person or the family or whomever to borrow that device to really put it through its paces to see if it works or not. And a lot of times I've seen families and individuals and people go down the road of thinking, somebody tells them that this is good, this is the thing for you, and then they go out and purchase it, and it's costly or whatever, and then they figure out it doesn't work. So this exploration program is really trying things before you go out and either buy them or acquire them through other means. What that does is kind of limits the failures a little bit, so that you are the decision maker, you or your support network is helping you make a decision on things that's really informed. So you have all the information, you're looking at things that might be helpful, and then you kind of make decisions. So we kind of put the person right in the middle of that and encourage them to make informed decisions and be a part of that process. And sometimes that can be a little much for individuals, and the service networks and all of the stuff that one has to navigate can be very daunting. And a lot of times, the service delivery model, you kind of get what you get, and you're brainwashed into, all these other people are making decisions for me or for us or for our families or whatever. And so we try to kind of take that out of the picture and make sure that, that person really knows as a self-advocate what they want, what their goals are, and providing that assistance to get there. The other piece is the training and technical assistance, and these are more state level activities that are targeted efforts on specific issues, policies and procedures, or barriers that might help agencies understand what their responsibilities are for providing assistive technology or not, and helping them kind of fill the gaps in there. Because if you have gone through processes, a lot of times you go take a few steps and then there's nothing happening. And so that would be a gap that we would identify as a problem, and then help state agencies, private nonprofits, or whomever say, hey, if we had this policy change or procedural change, maybe that would help people acquire assistive technology and be more successful in their lives. And then there's a bunch of different transition types of scenarios that would come in there too. Like what's the barrier? What's preventing one from accessing the appropriate technology? I'm sure lots of the families and the people out there that have gone through that have hit those brick walls and have gone nowhere. So we tried to help the state entities or the other service providers to understand that, yeah, there is some responsibility there that exists, that we can improve services and service delivery in regards to assistive technology. The last one is public awareness. this is just basically our outreach efforts to make sure people know who we are and what we do. We do quite a bit of conferences. We do a lot of Zoom and other types of outreach efforts, and just general community education. Assistive technology services and programs kind of, we can always do a lot better to get the word out more about what we actually do, because I think there's confusion that exists out there about what we can do or can't do, and we just want to make sure that people understand that we are, if you have a disability, that and assistive technology, for me as a wheelchair user, I mean I use AT every day, and I have the feeling and the philosophy of our program that anyone that has barriers, challenges, or trying to do things, they can benefit by assistive technology throughout their entire lives. All right, so specifically regarding transition from an Assistive Technology Act perspective from the federal government, they are very, the definition of assistive technology regarding transition is very, very broad. So it can be any age, any scenario where there's any changes that might occur along the lifespan. And that can be from, early learning kinds of things, finding out about the disability if the person, is born with that disability. And when they get a certain age, when they start learning language and all those other things, assistive technology can play a role in that early childhood stage. And then entering into K-12 and all of that, transitioning to employment, community living, that is all part of the definition of transition. And then when you age, there also is a transition there. I know with me aging with a disability, it is there's changes that occur all along that the whole spectrum, and I am changing my assistive technology as I go. It also could be with community living, independent living, assisted living, nursing home kind of situations, and all the way through end of life. So it's a very, very broad definition of transition from an AT Act perspective. So just a couple points that I just want to make on this part is having that plan. And if it's a regional center plan, it's looking at that and making sure that you have that language in there that talks about what it is that you need, whether it's assistive technology or anything to move your life forward. Having that in a plan, having that in there as early as possible is probably going to be beneficial for everyone as you go through that. The other part is to really think about what your goals are and to think big about what those goals are. So when people have, like Jack or Noah or anybody else that say, hey, I want to do this. I want to have my own business. I want to do this or that. Don't be afraid to put those goals out there and talk about them and make sure everybody knows that that's what you're trying to accomplish, and to kind of go big on that as well. So a lot of the service delivery sector can be a little limiting in that area a little bit. So, some people would okay, because I have a certain disability, I'm only going to be able to get this. And I think assistive technology can play a big role in helping you get to a higher level, depending on what your overall goals are. So regardless of disability and how that impacts your life, we think that AT can play a role with that and improve the quality of life. From my perspective as a spinal cord injury I've seen AT as far as wheelchairs go from 50-pound hospital type chairs to really sporty, lightweight wheelchairs that improve my quality of life every day. The technology and things like that play a big role in my quality of life. So I just wanted to talk a little bit about some of the popular AT that I see out there with um, some of these different people with certain barriers. So talking about blind and low vision, there's the new meta glasses that are out there. There's different types of braille displays that improve communication. Low level things like just handheld magnifiers up to more complex things like different types of readers that would be able to read out loud print material. Hearing loss is a big one too. So there's lots of things that have to do with amplification, visual alerts to help with who's knocking at your front door, to your alarms going off in the morning, captioning and transcriptions. I think with Zoom now we have language translation and captioning and online interpreters and all of that. So whether we call it AT or not, that those things are out there and they are available, and hopefully people know about them and are using those tools. Some tools you'll know about and have heard about, but other tools you might not have. Communication is a big one too, whether it's educational or learning aids, having things like reminders and other different types of aids that help you with processing materials, and whether it's K-12 or other types of things that you want to try to access. Those things are out there. There's the augmentative communication. There's a lot of new technology that does eye and face tracking. So instead of if you have difficulties with your upper extremities, some of these communication devices these days will track your face, and you can use different winks and smiles and gestures with your face that tracks that, and you can scan and search things and click on things with a mouse. Eye gaze is a popular one that tracks your pupils, and you can control your computer and communicate with that. So speech to text, text to speech, there's a lot of things out there that can improve your communication at all levels. So if you need to point to pictures or things like that to communicate, there's those things. If you have the ability to text using your phone and then reading things out loud, that would work as well. All of the daily living things, so bathing, dressing, grooming, all of those things that help you, put on your shoes and socks and get in and out of bed, or, if you need a shower chair or different ways to do all of those things that you have to do every day are popular. And a lot of times Mike will talk more about some of these things that CareChest provides as a resource that just helps with just getting out of bed and getting ready for the day. So there's different things that helps with transfers, whether they're lift systems or just slide boards or shower benches, things like that. There's a lot that as we age, having things like fall detection. So whether you're talking about monitoring systems or things that you wear, whether it's the alert buttons that you wear to contact someone, or the Apple Watch has fall detection for people also. So the idea on some of these things, especially for the people that are aging, is that we don't want them falling and breaking things, and then that putting into motion a series of things that would impact their lives. So there's also things that do tracking. So if someone has the need for making sure they know where someone is, or that they're not where they're not supposed to be, there's ways to kind of use GPS to track those things as well. Also, recreation and leisure. I think this is one that might be overlooked a lot, but there's all sorts of things on adaptive gaming. Some of you guys might have seen the Xbox controller. That's an adaptive Xbox controller, but there's all sorts of different technologies out there that help individuals if they want to do gaming, whether it's on their computer or on a console or whatever. There's lots of adaptations that are available to explore with that. We just finished up the adaptive fishing day at Sparks Marina on Thursday, and we brought battery operated fishing poles and other types of tools and things that might help individuals with various disabilities in fishing. They also have things for hunting and other types of devices that help individuals just explore the outdoors a little bit more. So when I popped on, I heard a lot of things about people, the individuals with the jobs and the things that they're doing. So it would be a good idea for me to mention self-determination in all of this as well. So making choices, who is in your support network is really important. And I think as the parents were talking, there's always a network of people that are there to help push that forward, and identifying who those people are and what kind of support that they're providing is always good. And as a person, do you have choice along the way? So that's part of the whole process of figuring out what you might want to do. And I think I heard a little bit from those support networks that traditional mechanisms sometimes are so rigid that they don't allow you to think about what you want to do. And so I think that's really important as it relates to assistive technology as well, as that you like, hey, what do I want to do with my life? Do I want to, make popcorn for people, or do I want to go and I missed the first part of Noah's presentation, but do I want to do something else? So having that decision making, being involved in your own direction in your life is really good. Know what your options are. A lot of times people will know more of kind of what they don't like okay, I know that's not for me, so I want to focus on other things, and that's great. Don't forget to include your peers in the whole process, and I think that's a big thing that I focus people back to, because as a wheelchair user, I know wheelchairs and durable medical equipment and those types of things, but I don't know communication devices and what it's like to be blind or have any barriers with learning or processing or anything like that. So I try to, provide information and then encourage people to make sure they're talking to their peers. So people that have already been there and done that, Marcia, Maria, Diana, everybody that has kind of paved the way, you have to talk to those people to know what worked for them and what pitfalls to avoid and all of that. We talked a little bit about setting the goals. Make sure you know what the barriers are and what is needed to maybe address those barriers and what you're trying to accomplish every day. Assistive technology can be a little intimidating, but it doesn't have to be. So you want to make sure you explore all of the things that people are talking about and really understand what it can do or what it can't do for you, so that you have the best chance to be successful in whatever you're trying to do. I did say before that I think everybody can benefit by assistive technology, but I will say that again. Regardless of what your barrier is, what your age is, or where you are in life, I think having the appropriate technology that works for you is always going to be a benefit. So, talking about support networks, mentioning again the peer-based stuff and the other social networks, and I think Marcia might have kind of alluded to this a little bit, but you can have networks of parents and service providers and stuff like that. But I think what I kind of heard is that some of these groups of people want to kind of take that and take it outside of it and make it their own, and that's awesome. So whatever social network or community that you're belonging to, make that your own. Be a part of that process as a if it works for you. Current providers, we talked about regional centers. Vocational rehabilitation is a big one there to help with transitioning from K-12, and I don't know if at some point people would I'm was hoping that David was going to show up and talk about that whole process of transition from a VR standpoint, but doing that earlier the better. I think the law states that transition could be starting at age 14. So I would take advantage of that and make sure that you know what VR can do, and that you can talk to a counselor and have a plan to include vocational rehabilitation if employment or that is going to be part of your transition plan after school. There are different waiver programs, physical disability waiver, other types of waiver programs that people might be qualified for out there as well. And then working with potential employers. And I think that's an area where we really need that. There's a major gap in there that, some employers are really good about hiring people with disabilities and understanding their needs and providing accommodations and other supports, but other employers are not. And so, we can help with that and educate employers about, assistive technology and accommodations and things like that exist or that are needed by people with disabilities. And then, I've been an advocate for a long time, 35, 36 years or something like that, having an understanding of what your rights are and who are the organizations out there in those networks that can support that from a more formal advocacy standpoint, or maybe even a legal standpoint about, here's your rights. And if you feel that they're being violated or you're not getting the services and supports that you need, I always feel that, you try to resolve the issue at the lowest possible level if you can. Sometimes you can't. Sometimes you need the big stick to come in and help with getting you over the line, or if you're constantly getting denied something and you feel strongly that that's a civil right that you might have, then understanding those other networks that provide legal advice is also pretty good. All right, so and that can exist at the federal level. It can exist at the state level. It can, they're in your community as well. A couple different national networks that I just wanted to mention here is the Assistive Technology Act programs and the AT3. They're two national networks that have a ton of information about assistive technology resources. They do a bunch of webinars. I was on one the other day that an Apple representative came in and talked for an hour or so about all the accessibility features of, the Apple products, the desktops, as well as the the mobile platforms, the iPhones and iPads and things like that. But wonderful information about all the different settings that you can change on your phone for vision and hearing and reminders and all sorts of different things. So I'm thinking that you probably would just be able to Google AT3 or ATAP and do that, or I can um, figure out how to drop that in the chat, or Maria might be able to do that for you guys after we're done. Let's see, where are we at with this? So winding up, just the AT Resource Center contact information. This is our main. We have offices in Reno and in Las Vegas. So we're on the UNR campus. Here's the address. Feel free to kind of pop in and talk about or to the website that I have listed here. I also provided the Nevada Assistive Technology Collaborative's overview, which is a pretty good handout from ADSD and John Rosenlund, who is the kind of the director of that AT Collaborative for the state, and it lists all of our context information for myself, CareChest, NDLC, that talk about assistive technology. All right, I think I'm done, and I'm going to turn it over to Mike just to kind of fill in the blanks on what CareChest does, and then we'll throw it out there for any questions or discussions that you guys might have.
And if I might interject for 1 minute, I am going to send everybody in the follow-up email all of this the whole PowerPoint, so you can get that information.
All right, great. Okay, I'm going to stop sharing my screen.
Okay, I guess I'm up. I'm Mike Marbury. I work at CareChest. I head the independent living program for Northern Nevada. I have a experience in 20 years of respiratory therapy before I worked at CareChest. I managed a few durable medical equipment companies in Northern Nevada before I got my job at CareChest. First, big shout out to Noah and Jack. You guys are rock stars. I'm glad you have that really good family support. And I love what Marcia said about that because it does take a village. It is really tough to have a business. But versus going to the workforce, you have a lot of different challenges there. So that is really great. I'm going to try to share my screen. I am a rookie, so please bear with me.
So, Mike, we are not seeing your slides.
No, let me just start it again. Let me get
Yeah.
out of here and we'll try it again.
Yeah, just double check when you go to share that you share the proper screen, whether it's another window or a browser.
Gotcha. Let me try it again. Right. Well, I had this going all morning. It was working perfectly. Of course, now that I'm live, it's giving me fits.
It might be the recording that's asking you to give it permission to.
Gotcha. Let me see if I can do something here. Hold on. Yeah, I got Zoom, screen broadcast, start broadcast. It's just kind of timing out.
Okay, what you need to do rather than broadcast is to share your screen and the actual screen of the image that you're trying to share. So if you have, for example, a PowerPoint,
Gotcha.
then make sure that it's the PowerPoint. You can use the application window, or you can use just the screen that is on. And it looks
Gotcha.
like you've got a laptop, so you probably do not have two monitors to look at.
Yeah, I have an even better. I have let me see here, an iPad. Let me see if this goes here.
And if not, you can just go through, talk about the program
Yeah, let
and
me give it a few
everything.
seconds and I'll go ahead and give it another shot. One second. Well, anyway, while I'm fooling around with this, let me go ahead and tell you what CareChest really does. CareChest is, it's a 33-year-old nonprofit. We started way back when recycling medical equipment, and that has been a really big success for us. We just recently, 2 years ago, started an office in Vegas, so now we're a statewide. And let's see if I can do the SharePoint instead. I've been doing this for 8 years. We have different programs available. All right. Sorry, guys. Can you just see me? I'm just going to not share anything here.
Yeah, you look fine.
Okay, thanks. One of our many programs is Care Loan, and Care Loan is really important for people that want to transition and do goals in the home. Um, we're blessed years ago to have funding of, gosh, I forgot the amount, but it was a quite considerable amount, and it's actually funds that we have and we control, and we offer people that have a medical need for funds that maybe insurance won't pay for, like a CNI dog. We've done a couple of those for people. We've gotten transportation goals through care loans, doing medical mobility vans. One of the great things about that is we offer a 1% interest up to 15,000 on maybe a very long year term. This is really a great benefit to the community. If you have something like you need an autism bed, those beds are around $5,000-6,000, and insurances unfortunately will not pay. Once we get a denial about a person's need or they cannot do that, we step in and provide those funds. It's pretty easy to apply. Everything's online for that. We also have programs for medical equipment, as you all know that we do. Everything from hospital beds to shower chairs to canes to everything you can think of, including monthly supplies for diabetes, um, incontinence problems. We do that on a monthly basis, and we have a rural network that we actually deliver to communities. Carson, for example, we go out to Carson City once a month, and we drop off supplies at the senior center. We're located in the North Valleys and Golden Valley, and if you've ever guys have been there lately, oh, it's a nightmare with all the construction. It's horrible. For me, the commute, it takes me a long time. So the rural outreach is a really nice benefit to the consumers and clients that we have out there. We also have prescription assistance, people that need prescriptions. We provide a monetary benefit for those people that need their prescriptions. They just can't really pay for it. My program, the independent living program, I, like Scott, we follow the philosophy of independent living. We want to make sure that the person seeking out goals and identifying barriers it's going to be their choice. Whatever their life they want to be, whatever goals they may want to pursue, we make sure that we cater to what they want and what they want to achieve. I do work with Scott with people that may need different stuff like vision goals or communication goals. Vision goals can be maybe like Scott was saying, a little magnifiers. We do have machines that help you do your mail. We do help with hearing aids. So people that might have a hearing impairment, that we able to do that. The Care Chest is really nice. It's based on income based, but we have other programs like the programs. If you make a little bit too much, we have a program where you just spend $50 for the calendar year, gosh, you can have any equipment that you may need, whether it be coming out of a surgery or a rehab. That $50, if you make maybe too much, um, that will give you access to what we have in the warehouse. Some of the stuff we need a prescription for, like a pulse ox or anything like that. But some of the stuff is no prescription required. But we do have that program. My program as an independent living specialist is I go out to the person's home, I identify the goals and the barriers together with that person that's applying. We take a long 2-hour visits in the home to make sure that whatever solution that we might come up with is not set up for failure. Um, we do have funding available that's provided by the state, where that's a last resort that we access those funds. Normally, we go through your family resources, Medicaid, Medicare, insurance, maybe other agencies. But when it gets to that point, we do have that available. What's a blessing right now, of all the years that's been doing this with the state, with John Rosalind, we've always had a waiting list. A waiting list was somebody come up with a home access goal and they desperately needed a ramp, so to get out to the community. That's extremely important to get out to access in case you had a medical emergency or you just want to go shopping. It's imperative. With the wait list, it used to be for years, you would maybe have to wait for a year unless you were extreme priority to get that done. So unfortunately, that was the case, but now we're blessed to have no waiting lists. So we're helping folks transition out of the home with no waiting list currently available. So that's been a really big plus. And we're blessed to work with Scott with people that might need these vision goals and trying to help, whether it be somebody that's blind, that's trying to figure out how to get around their home, how to exit their home. Um, we take all kinds of people that have all kinds of goals in their life. So that's what we do. I don't know if you guys have any questions or anything about what we do at CareChest. I'm sure sorry about my slide. I've been working on this darn thing. Obviously, I got to work on it a little bit harder, but
Mike, I
Mike,
did put your contact information for both your Reno and Las Vegas offices in the chat. So if anyone wanted to jot those down, that would be great. And then you can reach out after the webinar.
yeah, that would be great.
and then Mike, I was just having you maybe talk a little bit about the vehicle mod kind of program and what you guys kind of do with people that have transportation goals.
Yeah, the vehicle mods it's kind of a quite good range of stuff we can do. I'm working on a gentleman that he has MS and he just he can't drive. But he lives with his sister, but he can't get into the passenger seat. We're working on something called a tourney seat, which kind of has that passenger seat kind of turn outside the vehicle, so and lower, so he can actually get in and out of the van or car. It can be done on a lot of cars. That way, he can access his mobility device and get access in the car. And of course, we do mobility vans with the slide outs. That's really a really good thing. We have two options in that. We can have persons that want to have a van and actually want to drive. Now, that involves a few other things. We have another company we work out in Sacramento. They're called Cappuccino Therapy. I mean, I love that name right away because I'm a coffee drinker. But they come out to Northern Nevada and they spent the week in a 40-hour class to get them to show them how to drive with, the hand controls. And they have to actually pass that before we can go ahead and maybe possibly fund that. So we can have people that want to actually drive and access the community, or be simply just to be a passenger. And that's really nice range. And also we do vehicle lifts for people that want to just have their mobility device, be a scooter, power chair, even a wheelchair. into the back of their car. And we have a couple of vendors in town that help us with that. So we are able to help a lot of people with modified vans and stuff, because a lot of times it's really important to have that, because we've transportation for people for that are use a wheelchair, especially in dialysis. They have public transportation. They have the flex ride, but as you know, these appointments for the medical appointments, especially dialysis, they have to be there on time. And the flex ride and the public transportation systems work on people that they have a lot of rides. So if you get picked up at 9, you got to pick up with something else. You're in quite peril of missing your appointment. And especially if it's dialysis or something like that, you're not going to make that. You actually need your own vehicle to get there. So we're blessed to do a lot of modifications.
And I was just going to add a little bit about the communication, process where, if someone doesn't have Medicaid or another pay source, that you guys at CareChest would entertain a discussion about a communication goal. And, if there's not any other program or resource to pay for it, that's something that we can go through you guys to acquire. And, that might mean you get you come to us, and then we have a discussion about what are those communication goals, what are some of the things that we can explore. It might require at some point getting maybe more information from a professional in the community, like a speech therapist or whatever, to help us guide that process. But if there's not another pay source for that, then that assistive technology for independent living program might be able to help. And of course, there's guidelines and things like that you have, but it is a resource for. I just don't want people to think it's all about physical disabilities or vehicle mods or anything like that, but it takes it's a variety of different things. If you have a goal and a disability and there's no other pay source to get you that device or thing, then CareChest will step in and you would work with Mike and go through the whole process. But I think people don't they might associate CareChest with the DME stuff and borrowing wheelchairs, walkers, and things like that. But that other side of it, I think, sometimes is something that we can promote a little bit better that as a resource. So
yeah, that is nice, because with Scott having his program where they loan these devices out to kind of have that consumer to try. And then when they figure out that, what, this is not so work, and maybe Scott will go to the drawing board and have another meeting and maybe try something else for a device. And as you know, the devices aren't cheap anymore or anything, but we really have a really good benefit. So when we do Scott does find something that does work, instead of the loan program, we can actually maybe fund that source as a last resort.
All right. I think we got about 10 or so minutes, Maria, or whatever. Yep. You want to just open it up to just general questions or scenarios?
Sure.
Or
yeah, we've got some things happening in the chat here. So Eileen was mentioning that she also hates her mail because one of her arms does not work as she would like it to. I just know that from knowing Eileen. She's amazing. And it looks like she was talking about a vehicle mod. She says she has a truck. She needs to carry her chair. The Braun ability unit is something she's looking into. So I've encouraged her to reach out to you, Mike, via the information that Marcia put here in the chat. I know Eileen lives in Virginia City, and she's not necessarily in an accessible location. So she's also looking for accessibility ramp needs and truck mods. And so she'll be reaching out to you. Let's see if she says anything.
Sure.
For some reason, we cannot hear Eileen today. So we'll see if she says anything now. Um, she said she's been denied for the truck mod from Neighborhood Network of Northern Nevada, from MTM. Yes. So anyway, and
Sure.
um,
I can email the application. That's where it starts. It's even the application is really a questionnaire, and the questionnaire is a little bit thorough. It addresses the vehicle mod or whatever the goals you would like, but it also goes into other goals in the home. So we can, when I do my home visit, I can do a whole evaluation and maybe in the bathroom area, maybe transferring the toilet, maybe the all cut laundry room, the kitchen, the goals like that. So once I get that questionnaire back, then we can kind of get a better whole picture of to see what goals we might want to address to make everybody more independent and safer.
that's great. Great. Thank you. And I know you may not know this, but we know a lot of the same people. I have a big network in the CP world here in Northern Nevada. And so Mike has helped with ramps on the exterior of the home, widening doorways, getting track systems installed for transferring. And I mean, CareChest has been invaluable in our community. And I see that Margaret Marcucci here, who's at the Elko Center for Independent Living, is also thanking you for
You
help,
bet.
yep, helped her friend with her van modification. And I love that there's funding available because modifications aren't what everybody needs, right? So
True.
some the scary part moving into adulthood for families with individuals with disabilities of any kind, and like Scott said, it doesn't have to be a physical disability. I mean, the scary part is the funding for all of these things that these individuals need to get in the community. So thank you for that.
Oh, you bet.
Um, Eileen says, broke down in cab 1 week ago, left in the hot sun, nearly called ER, dangerous cab rides. So she's needing modification. Yes. Anyway, anyone else have any questions for Scott or Mike? Oh, go ahead, Judy.
I have a question, well, for each of you, but for Mike, I have a question about when you're talking about transport and being able to learn to drive and whatnot. One, for hand controls, do you have to have use of both hands? And my guess is that it's yes, because if you only have use for one, I'm guessing that it'd be really difficult.
Right. One accelerating, one for brake. Yes.
Okay, because not having your own transportation, if you're in a wheelchair and you're a university student, your social life is terrible because your access is so hard and nobody has
Sure.
a way of just spontaneously saying, let's go here, let's go there, because there's no transport, and socialization is such an important part of college life. It is so frustrating for me to watch some of this
Oh,
stuff.
extremely. It is very important, especially at that age. And that's what we're all here for. And we want to achieve to make sure that everybody has the same, same, same opportunities, whether it be social or business or work. We're doing that. And yeah, it is extremely important to be social.
And
And
I'll just add to that transportation is a hot topic. It's always been at the top of the list to be able to get to places that you need. And I think Mike was alluding to the fact that the fixed route bus system, runs on times and stuff like that, but it takes a while to get from A to B. And then if you were relying on paired transit, the RTC access, you could be on the bus and missing your appointments or late or early or whatever, and that might not meet your needs. So I'm thinking that that part of the transition into adulthood where you're looking at being more independent in that and going places, whether it's the college campus or social networks or wherever you want to go to activities and events that are around town, that you're going to have to make some decisions about how you want to do that. And I think the goal of these types of programs, Mike's in our program, is to make sure that to the extent possible, people are as independent as they want to be and they can be. So that's the goal of all of this, is to move somebody from being dependent on something to having a little bit more control of what they want to do and how they want to do it in their lives. So, I appreciate Judy's input on the bigger picture of it all, because a lot of times, when you're in the service system, you lose that, and just having people that can, talk about the bigger picture, the diversity thing, and just being a part of your community is a good thing. And I think a lot of times we lose that in being that victim of the service delivery process, or that whole all of the burden is on the person a lot of times, and we forget the big picture and what we're trying to do a lot.
Well, a simple thing like dating is such a part of from middle school up. And if your brain is working fine and everybody, but your body is so limited that you're in a really heavy wheelchair. My patient, I don't think she's ever dated. I mean, it's an important part of life. And when you talk about planning for the future, you have to learn to socialize with all different kinds of people. And that's a big zero for the patients that I work with.
Yeah,
So
it's about getting out there and getting out there where all the activity and the action is, and
age appropriate learning, that's not there. But I have to ask you, Scott, because I have a huge frustration, and it's such an easy fix. It's such an easy access and safety feature. And okay, I go to a physician with the renowned system. My son-in-law is a dean at the medical school. My daughter is a pediatrician. And when I go to their office for my treatments, I took a picture of their steps, because you take a picture from the front, from when I enter, you can see the steps. When you take the picture from the other side, you can't see the steps at all because of the way the light is and all that sort of thing. I have had patients that kept falling at at home at the same place, and it's because they couldn't see that step that was there, and they didn't have any other. I hate the word disability. They didn't have any challenge like that. So I took pictures to show I showed my physician to say, this is not safe for your patients. And so nothing happened. So months later, I showed it to my son-in-law. Nothing happened. I talked to my cousin who works with the university system in California. He said, oh, well, I'm sure you have to talk to this administrator, that. Well, anyways, it has been a couple of years now, and it's never fixed. I told them, in past, I would have come in the middle of the night and put striped your steps. But now you have cameras and things. So then I'm going to be in trouble, and I can be sued. So I can't make that accessible. It is such a simple fix. And for several years, I cannot. And so you're at the university. How the hell do you get a simple thing like that done?
so that's where the ADA kind of comes in a little bit. So I have another project that I direct at the center on ADA specifically, and I think not only is it a barrier, right? The disparity of people with disabilities having access to the things that they need in the health system is horrible, and it needs to improve dramatically. And you'd think that having fixing the putting a ramp in, or handrails or
They have
whatever.
a ramp. This is for able-bodied people to keep them safe too. I
Yeah.
mean, when you make it accessible for people with a dis in front of their whatever that drives me crazy. But you make it accessible for people delivering things with hands full and all that. It makes the world accessible to everybody. This just is like I could go buy a tape and it'd be less than $10, and I can make that safer for everybody. It doesn't happen.
Yeah. So if anyone has issues like that with accessibility barriers in the community, ADA or whether goes into anything else with assistive technology, they can give me a call and we can kind of talk about that. And sometimes when I send an email, find out who the owner, the property manager, whoever might be responsible for improving that, I can advocate and help the person advocate for getting things changed. At a certain point, there's only so much you can do to try to encourage them. And then they have to kind of figure out how to do that on their own. But I think, a little bit of self-advocacy, a little bit of supported advocacy from the community and other programs can help that. And then I don't think I even want to go into the medical diagnostic equipment and how people with this significant disabilities get x-rays and imaging and all that other stuff, because that's a huge problem now. But I think there's other things that are moving that forward a little bit. So hopefully, people with disabilities, especially the more complex, barriers out there can be addressed, because people aren't going to doctor's appointments. They're not getting the imaging. They're not able to, if you can't transfer yourself, then they sometimes put the pressure. Well, then you have to bring somebody to help you transfer and all that. So there's a lot of, I think you and I, Judy, have talked for in the past a lot about these things, and there's just trying to push those forward and get a resolution to that is a problem. I agree with you, but we can't stop. We got to keep pushing, right? Everybody's got to keep pushing and asking for improvements and things like that. So
I am going to make an appointment with you.
you just give me a call, or I think my phone number is on there. Give me a jingle and we can figure something out.
Totally. There's lots and lots of things that are
Yep.
easy and don't even cost money. They're just so easy. So it's so frustrating. So you're connected.
Sorry. Maria, any more questions from
Yeah,
my
so Eileen just has one question, wondering if you would share a little bit more about your ADA advocacy all over Nevada. Just a little piece on that.
Yeah, so when I first came to Reno in 1989, I worked at the Center for Independent Living in well, it was in Reno, now it's in Sparks. And then in 1994, I was hired up at the university to direct the ADA Nevada project. And so I've been doing ADA information, sending out materials, going out and doing site reviews, helping people be more accessible in the community, not only physical accessibility, but anything else for blind and visual impairments, effective communication, really a whole gamut of other types of accessibility things that can help improve access out there in the community. So I really don't have any authority. Just as a self-advocate and going to dozens and dozens and dozens of ADA trainings throughout the years is where I get my experience. And then, of course, I'm a wheelchair user, so when I roll up and see barriers and that's an effective way to kind of get the message across as well. But yeah, that program is out there, and I would help people advocate. I'm not the ADA police, so I would help the person, whether it's Judy or another user that's having specific issues and barriers. I would help that person address those and try to get things resolved, at the lowest possible level, informing them of what their options are, what their civil rights are, who has the responsibilities and who might not. So, and that's kind of where the assistive technology and employment primarily kind of cross over into some ADA civil rights and accommodations and things like that. So yeah, so if anyone with barriers out there that they see in the community can contact my project, and I can help them try to improve things out there.
Thank you. Margaret?
Hi, this is Margaret. I am actually with the Rural Center for Independent Living here in Elko, and I also do a lot of ADA stuff. And right now, it is working on getting my doctor's office, which is having an awful time trying to get the doors. And she has been turned down for loans. She sat the other day and we talked for almost an hour trying to figure out how she was going to get help to get these doors in, because she said, she looks at me and she goes, "Don't go there." I said, "Yes, ma'am." She says, "You're the ADA representative." I said, "Yeah, I do that too." And my biggest thing, and I'm a pain in the county's neck and the city's neck, because every time I see a violation, I go, "Hey, excuse me, you don't have, excuse me." Well, what are you going to do? Well, here's the rules. This is what you do. This is why you do it. And the best one, and you guys are going to love it. I have a pacemaker. I can't walk through the metal detectors without it turning the county does not have the wands to do the pacemakers. So that, well, you can go through there and have your pacemaker turned off. Or, and I'm looking at him, yes, ma'am, that's exactly what I was told, point blank. I have a court date and I told them they better get it fixed or I was going to have their buns in ADA, and I meant it. And I am not backing down. This is something that I have to do. I've already had my pacemaker go off after I did walk through one. I'm not going to have that again.
Yeah.
Wow.
Well, Margaret, you certainly can loop me into any of those issues, and I can provide my give you my 2 cents on what I think is going on. And a lot of times you're dealing with, you have to get to who is the owner of the property,
Yep.
and what if there's a lease agreement involved or whatever, that
Yes.
can be complicated. But really, those doctors, hospitals, healthcare providers in the private sector all have responsibilities under Title III of the law,
Right.
and they have to do what's readily achievable to remove those barriers. So,
She is so trying. I'm sat with her. There's grants out there. We've written grants. We've done this. We've done that. And I don't, nobody wants to help us because we're in Elko and she owns that whole building. Yeah. See, there's
one of the
three.
things that I suggest, and the way that I look at that is, you would look at the total resources of that owner of that property, and then determine whether putting in an automatic door or doing something with the doors is readily achievable. So
Yeah,
there is some guidelines that are out there with that. And I tell the person, like, you would have to save, just like if you wanted to do put a ramp in or have an accessible playground equipment or something like that, you have to budget for it. You have to say, okay, this is what I want to budget. It might take a year or two to do it, but I think there's probably things that you could do that are more on the readily achievable side than, I don't know if you're talking fully automatic doors or power assist doors or whatever, but I'm willing to talk to you, the owner, the people, to just say, hey, here's some possible solutions that you might want to look at, and then give them those options, and hopefully they make little improvements over time.
Well, and that's what she's trying to do. And I applaud her for that. I mean, I do. And as many years as I've been using the physician, she knows it, and they're very much aware of it.
Yep.
Thank you both. This is a great scenario. We are a little bit over time, but I want to kind of speak to this as well. So my daughter uses a walker, and there's a store here in Reno that she loves to go to. They have an accessible sign in the window, right? The blue wheelchair symbol, um, and zero accessible way to get into the store. So I mentioned it to the manager. So you see that symbol, right? That means that this is an accessible store. But my daughter couldn't open the doors to get in. So anyway, I too bring these things up often in public, and I want to say here that, Hannah here, if you see the little name Candy Crush, Hannah made a little note. She said, I am at UNR2 and I am in P2I and I am a self-advocate. So thank you for joining us, Hannah. We need more of you. She's an amazing little human there.
One thing that I will just mention as far as doors go, the ADA is pretty horrible because automatic doors are not mandated even in new construction in the ADA. There are some exceptions for state and local governments and universities and stuff like that have a lot of people with disabilities, but they're not mandatory under the law. They do talk about door pressures and things like that and the widths of the doors. But if you have a significant disability, walker, wheelchair, power chair, anything like that, you really need a push button and an automatic door. But unfortunately, they couldn't get that in the ADA, so that's not a mandatory requirement. But a lot of places, certain types of stores, grocery stores, doctors' offices, offices of healthcare providers that deal with a lot of people with different mobility devices and disabilities, they will make a decision to say, okay, it makes sense for us to have that, because I've dealt with a lot of people that have fallen trying to get their walkers and stuff through doors, especially the exterior heavy doors. Once you get a couple trip and falls, I think down at St. Mary's, they have a series of different doctors' offices and things like that have had those situations where people have gotten stuck in the doors or have fallen, trying to get in the doors. So that's just a vague thing or a bad thing about the ADA that we couldn't get in there when it first started, these mandatory automatic doors or power assist doors. So it's always a fight, Maria.
It is pretty crazy. I notice it all the time, everywhere, right? Because if I wasn't with her, how does she become independent in the community without even be able to open a door to go into a store, right? Anyway, we are over time. Does anybody have any last questions for Scott or Mike?
Yeah, so I just want to end with if anyone has anything, any barriers or things like that they think technology can help with, just please reach out. And between Mike and myself and all of our team around the state, we'll be able to get you in the right direction to address some of these challenges.
And these are statewide. So just so everybody knows that all these programs serve the entire state. Okay, Marcia, if you'd put up the end slide, that would be great. We have another little survey here. These will also be in the follow-up email. But these really help us guide and to know what the community needs from this transition webinar series. Please take a minute to fill that out. And thank you so much to all of our speakers today. This was really informative. I hope that you all learned a lot about self-employment in the state as well as assistive technology. So thank you for joining us.